Hey everybody, welcome to another episode of Dr. Shoukas Answers. Today I'm here to answer the most common questions that you, the viewer, have sent to me via email, text, Facebook, or Instagram. Today's topic is going to mainly concentrate on non-surgical rejuvenation and facial fillers versus Botox. So let's just get into questions. What is a good starting amount for fillers? There is no starting amount per se. So again, it's patient dependent. The way that fillers come is they come pre-loaded in syringes. So it is a syringe, it's a 1 cc syringe, and it's already loaded with the filler. So the minimal amount of filler that you can really get as you're paying for a syringe is 1 cc. That ends up being a conversation you should have with your dermatologist or your plastic surgeon as far as what are the areas that you're concerned about. So you should be able to have a full facial analysis from whoever your provider is who can sit down with you and say, listen, I think you have these areas of concern, and 1 cc of filler may do it, or you may need 2 cc's or 3 cc's or so on. But there is no hard stop on the minimal amount of filler other than the way it comes preloaded, which is in a 1 cc syringe. Question number 2 is, when would you use filler over Botox? So fillers, hyaluronic acid fillers, Restylane, Juvederm, Botox, Dysport, these are all terms that are thrown around pretty loosey-goosey, and they're not the same things. So the toxins, the Botox, the Dysport, those are injections that are used to literally paralyze small muscles of the face that when you animate or make a face, you smile, you wrinkle your forehead, you raise your eyebrows, the toxins literally paralyze those muscles so you can't make those faces. That helps the skin relax and helps the wrinkles go away. The filler family of products, whether it's the Restylane, the Juvederms, or the Sculptras, are used to add volume. So think of it like spackling on a wall where you have a crack and you fill it. Fillers can be used to fill wrinkles from the inside. They're placed inside the dermal layer to pop those wrinkles out, or they're placed in the deeper layers underneath the skin to add volume, for instance in the cheeks or the tear troughs. So they're both used to help with rejuvenation of the face, but they're used in very different ways. That is an excellent question that I get all the time. If you already have fillers, can you use a different filler in the same area? And the answer is yes, you can. So again, depending on the area and depending on the patient preference, within each family of filler, there are multiple different levels of filler. So there's thinner fillers, thicker fillers, and medium fillers. A lot of times we will stack fillers. We'll use deeper fillers in the deeper layers underneath the skin, and then on top of that, for finer wrinkles and finer lines, we'll put a thinner filler. So can you switch brands? Can you switch from Juvederm to Restylane? If you had Restylane last time, can you get Juvederm this time? The answer is absolutely. They are all. Excellent question next. A lot of my young moms are asking this question. Are fillers and Botox safe to use when breastfeeding? So there's a little bit of a medical legal issue here, and the answer is they haven't done a lot of good studies to determine whether or not Botox or fillers are safe during breastfeeding, because no one wants to really experiment on pregnant women, and rightly so. So the answer is, in my practice, I do not do anything on women who are breastfeeding. I don't do anything invasive. I don't even really do any surgeries on them. What can cross the breast milk barrier? For me, I don't even risk it. There's no good studies to say it's not safe, so I don't want to pretend like it's not, and there's plenty of people who do. But for me, I'm not going to do Botox in someone who's actively breastfeeding just because we don't have concrete data that says it's absolutely 100% safe. And the next question, do all fillers metabolize on their own over time, or you do need to have them dissolved? And the answer is, it depends on the filler. 10 years ago, we had a whole different class of fillers which were a little bit more permanent than the fillers that we have today. Most people today, in general, I'm making very sort of rash generalizations here, use the hyaluronic acid fillers, the Restylane, the Juvederms, those two families, or the poly-L-lactic acid like Sculptra. Then there's another class called Radiesse, which is calcium hydroxyapatite. The answer is, for the hyaluronic acid fillers, which are the most common that you see every day and you see on social media, they are absolutely dissolvable. They go away over time. On average, somewhere between 10, 11, 12, 13, 14 months, they will dissolve on their own. Your body will metabolize them just like they metabolize anything else, and they do not need to be dissolved. This is a common question because for some patients who get filler, who aren't happy with it, or it's too superficial, they do make a product called hyaluronidase. It is a product that you can inject to dissolve the filler. It's like an eraser. You can inject it and it makes the filler that you put in go away. But you absolutely do not need to do that. You usually only do that when you have filler that you don't like or you put it in a spot that was too superficial. So no, the HA fillers, the hyaluronic acid fillers, will go away on their own over time. If you're not happy with a certain product or you don't like the way it looks, it can be dissolved, and that's something just to discuss with your provider. All right, guys, thanks for joining me. It was another great session of Dr. Shoukas Answers. Keep them coming, and hopefully see you soon. Bye-bye.